Good afternoon and welcome to the OR Today webinar series. We're excited to have over 420 registered attendees for today's webinar. I want to remind you today's webinar is eligible for one continuing education hour and that the post-webinar survey and certificate process is now automated. So the survey link will be included in the follow-up email, which you'll receive about an hour after this webinar is finished. Once you've completed the survey, you'll be able to download your certificate immediately. Let's kick off today's webinar by giving an OR Today live surprise pack to the attendee that can tell me the answer to the following trivia question. Today is OR Nurse plus its Perioperative Nurses Week. Which famous Civil War nurse founded the American Red Cross? Answer now using the questions feature on your dashboard. While you're answering, I just want to remind you to save the date for our 7th annual OR Today Live Surgical Conference, which will be taking place August the 16th to the 18th, 2020 at the Omni Interlochen Hotel in Denver, Colorado. Join us to discover new opportunities, broaden your knowledge and exchange ideas. For more information, visit ortodaylive.com. Okay, and let's see who the winner is, and it is... where are we? Denise Jeffries. Congratulations, Denise. The correct answer, of course, is Clara Barton. OR Today would like to thank our sponsor, TrackCore. TrackCore is a dynamic and growing company headquartered in Grand Rapids, Michigan. Track began with a vision and commitment to improve patient safety surrounding biologic tissue and implantable medical devices, and now serves more than 625 hospitals nationwide. For more information, visit trackcoreinc.com. Okay, our presenter today is Jesse Liebler, Sales Manager at TrackCore. Jesse, you may begin whenever you're ready.
Perfect, thank you. I appreciate the introduction. Good afternoon, everyone. As mentioned, my name is Jesse Liebler, and I am the Sales Manager here at TrackCore. First of all, thank you for joining me today and tuning into our presentation. Some of you may already be familiar with TrackCore, but for those of you who aren't, our organization provides industry-leading tissue and implant management software. The software is designed to help your organization with regulatory compliance, as well as inventory control of heavily regulated biologic tissue and implantable medical devices. We do provide a robust software platform that factors in all of your implantable workflows, and it's really designed to improve patient safety and eliminate any manual steps in your day-to-day workflow. Today, we're going to go through a quick history of TrackCore, along with key software features and benefits of our application. And then we're going to follow that up with the classification of what truly is a tissue and what are the regulatory guidelines that are in place that the FDA and Joint Commission and other accrediting organizations have that pertain to your hospital. And we'll also talk about the classification of medical devices, which ones are deemed as tracked medical devices, and the related regulatory guidelines for those product types. We'll then talk about unique device identification standards, or otherwise known as UDI, and how that applies to both tissue and implantable medical devices. And we'll finish up with best practices for tissue and implant management, followed by recommendations that we have for you from our partner facilities. To get things started, I wanted to provide a bit of a background on TrackCore, which was founded in 2002 under the name LPIT Solutions. At the time, we were a custom software development company, and we first created our TrackCore software in 2006 with the help of a nationally ranked health system here in the state of Michigan. That software was first and foremost for biologic tissue compliance to help that 11 hospital system standardize their policy and procedure throughout the enterprise and to eliminate manual paper process that they had in place at that time. It took us several years to fine-tune the system, and what happened is in 2014, we actually rebranded our organization under the name TrackCore Incorporated. At the time, we had diversified our portfolio, and we really extended what we were doing with tissue tracking to offer several different solutions intended for all other implantable workflows. And I'll talk on the next slide about that product platform and what those unique software opportunities are. And as we fast forward to present state, we now have a live presence in 45 out of the 50 states. More than 625 hospitals use our software nationwide, and we are the industry leader in the space of tissue and implant management. As a product platform, we do offer unique solutions for different use cases that deal with your tissue and implant records throughout the hospital. Our flagship application is what's known as TrackCore Operating Room, and this is our tissue and implant compliance software that's designed to increase patient safety and eliminate manual processes. Then we have a solution that's rather new called TrackCore Same Day. This is an exciting software platform that allows us to automate bill-only implants. All of the products that your vendor reps manage and walk in day of surgery, we have the ability to communicate that information electronically, capturing that and communicating between your health record and your purchasing systems to standardize the process for your supply chain departments. And lastly, we offer a solution known as TrackCore Interventional, and this has a slightly different focus. Instead of compliance for biologic tissue, the focus here is more on controlling costs, outdates, recalls, and other areas that deal with consumable and implantable inventory in your interventional radiology, cardiac cath lab, EP, and special procedure areas. It does factor in implant tracking workflows, especially in the area that the Office of Inspector General is now regulating for warranty tracking. Warranty credits, related no-cost replacement claims, things of that nature for pacemakers, leads, and other explanted implantable devices. So that is really, to summarize, the product platform for our TrackCore software solutions. In addition to our software solutions, TrackCore also has RFID secured enclosures. And these are ambient, refrigerated, and frozen units that are at all times locked and securely counting and monitoring your inventory. So coupled with the software, we can communicate with these enclosures to record things like temperature and record continuous temperature monitoring and alerts for these heavily regulated and temperature-sensitive products. And what it does is it provides increased staff accountability. It provides an automated inventory cycle counting tool for your supply chain department. And it increases things like lost charge capture because we can know in real time where your inventory is at and monitor that more closely. The software itself also comes standard with several features. So we do have a live integration with the National Recall Alert Center. As you receive and consume these implantable products in our database, you're automatically linked in with the National Recall Alert Center, and we provide those proactive alerts to help you better serve your patients and maintain those records. We also contain an entire vendor document and product database that contains related documents for regulatory compliance, such as your FDA licensing, your AATB or American Association of Tissue Bank licensures, your instruction for use documents that tell you how to store and properly prepare and handle your biologic product types. And we communicate with your vendors electronically to return tissue and implant usage return cards. Those are the important documents that your manufacturers and vendors rely on from your hospital to document that tissue and implant products have been consumed and into which patient. You'll hear the term UDI throughout the presentation today, and our software is fully UDI compliant. What this means is that we're going to allow you to utilize barcode scanning technology from the point of receipt all the way through your process, to the point where we integrate with your health record and consume that inventory. So we can scan the product from the point of initial receipt all the way through to allowing you to scan it inside of your electronic health record. And our software communicates and integrates with all of the major electronic health records and ERP or purchasing softwares on the market. We are one of the only solutions in the market that allows you to track all implants from any vendor, whether they're in our master database or they're custom products that only your facility chooses to track. And we do that through that unique product portfolio, where we have tissue tracking modules, implant tracking modules for your non-biologic products, even hardware and bill-only implantables. And lastly, from a regulatory compliance standpoint, our software goes above and beyond to not only meet but exceed all of the FDA standards for tissue and medical devices, but also all of the deeming authority organizations such as Joint Commission, DNV, HFAP, and CIHQ. So all of those accrediting organizations that can walk in at any time and review your tissue and implant tracking policies, our software makes sure that we stay up to the compliance standard year after year. So now that you've heard a little bit about the TrackCore software, it's important that we discuss why our solution's necessary in the first place. And a fun story that I always like to begin with is the biomedical tissue services scandal. I say fun, but it's really not a good story. The founder of Biomedical Tissue Services was known as Dr. Michael Mastromarino. He was a former dentist in the New Jersey area, and he had illegally set up relationships with 30 funeral homes in the New Jersey, New York, and Pennsylvania areas. And while obtaining the cadaver bodies from these funeral homes prior to their embalming or cremation process, he was harvesting tissue and actually distributing them to area hospitals in the United States. And when the FDA caught wind of this, they issued a nationwide recall. They found out that more than 30,000 tissues had actually been distributed by this company throughout the United States, more than 10,000 of which were actually implanted into patients. And the sad reality was that more than 1,000 of those were never properly located or traced from the supplier to the patient. And what's crazy in this scenario is that tissue products are very heavily regulated. You would think with something like that happening, there must be a gap in the regulations. But really there are not. There's actually a gap in how the hospital is tracking these products. Tissue products are currently regulated by the FDA, the Center for Biologics Evaluation and Research, organizations like the American Association of Tissue Banks or Blood Banks, and CMS, and all of what CMS refers to as deeming authority organizations. Those are your state survey agencies and any accrediting organizations, or AOs, which again are the Joint Commission, DNV, CIHQ, and HFAP. All of those organizations issue standards year after year that tell you how you need to properly comply with storage and tracking of these heavily regulated products. So when we, as an organization, enter into a business relationship with a new client, we often see how they're tracking these products currently. And the sad reality is that most hospitals that have not pursued an electronic format are currently using manual logbooks, the good old-fashioned sticker sheet, maybe a homegrown Excel spreadsheet or homegrown database that somebody within the organization created. And oftentimes, those homemade solutions are only as good as the person who originally wrote them. When we have turnover and that person moves into a new role or leaves the organization, we're left with a broken process that's very hard to follow up on and continuously track compliantly. So before we can understand what the regulations truly are for tissue and implant tracking, it is important to understand how the FDA and other accrediting organizations define these product types. So I have two different definitions here, one by the FDA and one by the main accrediting organization that I'm sure most of you utilize, which is the Joint Commission. So the FDA's classification of a tissue is a human cellular, human cells or tissues intended for implantation, transplantation, infusion, or transfer into a human recipient. They are regulated as human cells, tissues, and cellular and tissue-based products, commonly known as HCTPs. The Center for Biologics Evaluation and Research is who regulates HCTPs under what's called Title 21 of the Code of Federal Regulations, specifically Parts 1270 and 1271. And we will talk about those here shortly. The Joint Commission has a slightly different interpretation. They state that human and non-human cellular-based transplantable and implantable products, whether they're classified by the FDA as a tissue or a medical device, are subject to their standards. So they also state that collagen and tissue products that are derived from plastics and polymers are not considered cellular-based products and thus are not they do not follow underneath the Joint Commission standard. So one of the keywords there is human and non-human. The FDA doesn't actually classify non-human tissue as a human cell, as an HCTP, and their regulations don't account for those, whereas your accrediting organizations will. And likewise, when they talk about medical devices, the FDA can establish a medical device classification for a product that makes it fall under the Joint Commission standards. So again, it's very important to understand what the classification truly is. They even go as far as saying that products that are derived from human or non-human tissue and cellular materials, but are rendered acellular at the time of use for the patient, they are not surveyed under the tissue standards. And they gave a couple common examples you might know, such as albumin and gamma globulin, as examples of products that are derived from cellular products, but through the manufacturing process, they're rendered acellular. And that obviously means lacking of the cells. So the classification is as important. And I've thrown in several commonly asked questions that we receive here at TrackCore. One of those is, how do I determine if a product is a tissue? Well, first of all, you can always review the product insert and the packaging. You can contact the vendor directly and find out, if they follow through with either the FDA or the Joint Commission guidelines. And the FDA actually provides what's called the Good ID database. You can go here and you can actually type in a description, as you can see in the image I've provided, and it will tell you the device characteristics all the way down to whether or not this is a human cellular tissue and tissue-based product. Otherwise, your options are to utilize and partner with a tissue tracking software. So softwares like TrackCore, we classify every product in our catalog to help you determine whether or not that is something that should and needs to be tracked. Another thing that's important to understand is that there are several different types of tissue grafts. You're probably familiar with these at a high level, but there are allograft tissues, which are tissue grafts from a donor of the same species as the recipient, but not genetically identical. So that's your standard product that you're purchasing from donors, your processed bone, tendons, skins, corneas, those types of organs and other allograft tissue are what's most common today. Now, xenograft tissue are tissue grafts or organ transplants from a donor of a different species from the recipient. And your common examples there are porcine and bovine heart valves, cow and pig tissue. Autografts and autologous tissue are another commonly tracked product that most of your hospitals or healthcare organizations probably do procedures for, and those are grafts of tissue from one point of the body to another in the same individual's body. So common examples there are your harvested cranial bone flaps, skin, vessels, even stem cells. Another commonly asked question in this regard is, do xenograft and autograft tissues need to be tracked in the same way that our allograft do? And the answer is yes. Whether your organization is doing this today, you do need to track all of those product types, and there are regulations in place either to satisfy the FDA standards or your accrediting organization standard. Some of those products are even tracked under that medical device category that we'll learn about here in just a second. And autograft tissues, very specifically, they have separate tracking requirements within both the FDA and the accrediting organization standards. Those unique requirements often include policies and procedures for identifying, tracking, storing, and handling those tissues, in addition to things like labeling requirements and expiration policies. Autologous tissue regulations, just so that you can note this, are found in the Code of Federal Regulations still, Title 21, specifically in Part 1271 that we'll look at in a few slides. So now that we've talked a little bit in detail about the tissue classification, it's equally important to understand what a medical device is and what these devices are that are required to be tracked per the standards. So currently, medical devices fall into one of three medical device classifications, Class 1, 2, and 3. Class 1 are those devices with a low to moderate risk to our patient, and then up to Class 3, which are those that pose the greatest risk to the patient. Furthermore, the FDA classifies medical devices as what's called a combination product. A combination product is anything that is composed of a combination of a drug and a device, a biological product and a device, a drug and a biological product, or a drug, a device, and a biological product, so all three. And what's important here is that the device classification itself is what helps to define the regulatory requirements for the device type. So you need to understand which category, which class that device falls into before you can even determine if it's a tracked device, and then furthermore determine what those tracking requirements are. So this slide does a good job of further identifying those medical device classes. Again, Class 1 medical devices are those with a low to moderate risk to our patient. 95% of these products are actually exempt from the regulatory process altogether, which means those are things like electric toothbrushes. They do not have any regulations that surround them that would put them into the category of a tracked device. Class 2 devices are those with that moderate or high risk, and they represent the majority of the devices in circulation today. So these are the ones that are a little bit in a gray area that you would need to do a little bit of research and look up to make sure that you're tracking them appropriately. You're a little safer, hence the star, with the Class 3 devices, which are those devices that have a high risk to the patient. These devices usually are life-sustaining or supporting devices, they're implantable, and they present a potentially unreasonable risk of illness or injury. So almost always you're going to find those Class 3 implantable devices in that trackable category. Another commonly asked question is, how do I determine the device class and the tracking requirements? Well, this one's a little simpler. The FDA actually has what's called the Medical Device Registry. So every medical device vendor is required to submit their devices through the FDA's Medical Device Registry, which then classifies them and groups them into one of 16 unique product codes. The class obviously helps to determine if this is a tracked device, but the specific requirements around what needs to be tracked are actually linked to that unique product code. And the nice thing with the way the FDA has this database set up is that you can click on that product code and it'll take you to a further listing that helps to explain what those unique tracking requirements are. So I do have a slide at the end today that will give you several of these links and helpful resource documents. So please reach out to me if you do want a hard copy, if you want to obtain a hard copy, and I've provided links to each of these areas that I'm referencing. One of those areas, now that we have kind of defined what a tissue and a medical device are, one of those sections of the Code of Federal Regulations is known as Part 821. This is very important to read and understand if you're in the supply chain or the clinical workflows here. And it outlines what medical device tracking requirements are, as well as what a tracked device is. They state that it's any Class 2 or 3 device that meets one of the following criteria. 1, the failure of the device would be reasonably likely to have serious adverse health consequences. 2, the device is intended to be implanted in the human body for more than 1 year. Or 3, the device is life-sustaining or life-supporting and used outside of a device user facility. So obviously outside of your hospital or your surgery center. These regulations are intended to ensure that tracked devices, once you've identified them, can be properly traced from the device manufacturing facility to the person from whom the device is intended, which is your patient. And a common keyword that it's very important to understand here as you read through the standards is final distributor. A lot of the requirements deal with manufacturers, and you'll think, well, I'm not a manufacturer of these devices, so these don't apply to me. However, the term final distributor is embedded throughout the standards, and it states that any person who distributes a tracked device intended for use by a single patient over the useful life of the device, that is what is included in a final distributor. So the term includes, but is not limited to, licensed practitioners, retail pharmacies, hospitals, and other types of device user facilities, which again would be surgery centers, outpatient clinics, anywhere that is acting as a final distributor. Furthermore, when you dig into the Code of Federal Regulations, Part 821, you'll notice that there are outlined very specific things that you, as a final distributor, must track at your facility. And it states that upon sale or distribution of a tracked device for use in or by the patient, the final distributor shall promptly provide the manufacturer tracking the device with the following information. And basically here they outline general product and case data, the name and address of your hospital as the final distributor, the unique device identifier, so there's that UDI term again, the name, the address, the information of the patient receiving the device, the date of service, the name and information relating to the prescribing physician, and then even when applicable, the date of the device when it was explanted, and the procedure and prescribing physician information for that explant procedure. So again, it's important to understand this because now that we've defined what needs to be tracked, these are the things that really truly require to be documented in your implant log. And the last note on this slide says that a distributor, a final distributor, or a multiple distributor shall make any records required to be kept under this part available to the manufacturer of the device upon audit, upon written request by an authorized representative of the manufacturer. So really that's on this slide to further identify to you that you need these records kept in a secure process so that at any time, if an authorized representative of that manufacturer requests information on a tracked device, you, as the final distributor, are required to provide that to them. So a commonly asked question on this topic is, where do I find a list of tracked medical devices to see what implants are listed? That way you can compare them against what you are and are not tracking today. Good news again, the FDA maintains a list of those medical devices that require tracking right on their website. So they update this list every time that they add a new product type or code to the list. And you can go here and see, aortic valves, breast implants, defibrillators, electrodes, mechanical heart valves. They actually just increased this list recently and notified our company, TrackCore, as well as many hospitals, of Mentor products. That's a very common vendor for breast prosthesis, including implants and sizers. So this is a growing list, and it's important that you keep up to date with it, save the link so that you can always go out and evaluate what those tracked device requirements look like. So we'll switch gears a little bit now away from the medical device world, and we'll talk more specifically about tissue. A lot of folks know that 21 CFR, again, which is the Code of Federal Regulations, Title 21, Parts 1270 and 1271 are what define tissue standards. And it specifically requires what are known as tissue establishments to screen and test donors, to prepare and follow written procedures for the prevention of the spread of communicable disease, and to maintain records. And you're probably thinking, well, my organization is not a tissue establishment. But some of you might be wondering, what does that actually mean? In the standards, if you read through them, they're pretty long, so we don't have time to go through them all in detail today, but you can basically identify if these standards apply to you in subpart A, which is the general provisions and basically the extent of the glossary of the rest of the sections. In it, it will tell you if these standards apply to you. And for the most part, if you're a standard hospital operating room, you are not going to be doing anything with donor screening and testing. Procedures and record keeping for donors and testing of that donor tissue. An inspection of the tissue establishment would not apply because you're not a tissue establishment. But if you read into 1271, which is the following section, the general provisions do explain that a lot of these standards apply to hospitals. There is a specific section that you'll notice here, subpart D, that's called the current good tissue practice. that outlines all of your storage and handling requirements from a hospital perspective. So again, to summarize, only Part 1271 actually applies to hospitals who are not registered as a tissue establishment. And here I've actually put an excerpt from the general provisions. For 1270, it states, regulations in this entire chapter do not apply to hospitals or other clinical facilities that receive and store human tissue only for transplantation within the same facility. So because you're just ordering it, storing it, and issuing it to your patient, this entire chapter does not apply to you. In 1271, there are several things that do apply to you. And just as one example, I've outlined that you must maintain and establish a system of HCTP tracking that enables the tracking of all HCTPs bidirectionally. And they specifically state from donor to consignee or final disposition, or from consignee or final disposition to donor, which again, we translate as bidirectionally. And again, there are specific regulations there for how you need to store those products, what you need to do at each receiving stage, the record keeping requirements, and the tracking requirements back to the manufacturer. So I'll transition again, a commonly asked question. If I receive tissue at my hospital, am I allowed to transfer it to another hospital in my network? And the reason that this is a common question is because of that tissue establishment keyword. A tissue establishment is much more heavily regulated than a hospital that just receives, stores, and issues products. And what the standards state is that that they allow for the emergent transfer of tissue between facilities, but they specifically call out that word emergent. They further define that as if it's a life-sustaining or life-threatening procedure that you would have the ability to transfer that between facilities. But what they state is that once the process becomes routine or regular and routine, the hospital must register as a tissue establishment and be licensed by the FDA. Some of your organizations might actually have this registration because of the fact that you transport tissue in between each of your facilities. But again, just to reiterate, the storage of tissue intended for use within the same facility does not require a tissue license, and that applies to our standard allograft, xenograft, and autograft tissues. So I'm going to transition again away from the FDA standards, and we're going to talk a little bit in heavy detail on what regulations do apply to the hospitals. And for this, I've specifically called out the Joint Commission standards because by far and large, they are probably the industry standard here. Most of your organizations probably rely on Joint Commission for your accrediting, and they are some of the most detailed standards. So I apologize if you use DNV or CIHQ or another accrediting organization, you will probably see a very similar theme here. And Joint Commission says that the following standards apply to hospitals that store or issue tissue. This includes any area outside of the clinical laboratory that stores or issues tissue, for example, surgery and outpatient centers and tissue banks. And what they have done is they have called out 3 specific chapters. Those are their transplant safety chapter standards. And in 030101, 030201, and 030301, you can find all of the regulations you need to satisfy a Joint Commission survey. The first one states that the hospital uses standardized procedures for managing tissues, and they call out 10 elements of performance, which are basically their substandards. The hospital traces all tissues bidirectionally, and they call out 7 elements of performance. And then the hospital investigates adverse events related to tissue use or donor infections, in which they call out 5 specific elements of performance. And I'll go through just a high level, a handful of these to give you an idea of how detailed they are. First, the hospital documents the receipt of all tissues. Well, that one's pretty basic, but then they further elaborate and they state that the hospital verifies at the time of receipt that package integrity is met, transport temperature range has been controlled and is acceptable for tissues requiring a controlled environment, and throughout their standards, they always indicate whether or not the verification must be documented, as they do here. One note that I like to provide here is that they do say that with the receipt of all of your tissues, if the distributor uses validated shipping containers, then the receiver doesn't have to physically take a temperature. They can document that the shipping container was received undamaged within the stated time frame. So that is something that always comes up in our implementations. People think that they have to have a temperature scan gun, and that's simply not the requirement. You need to read through those standards and really interpret them for what they're worth. So moving into a couple of the additional standards, the hospital's records allow any tissue to be traced from the tissue supplier to the recipient or other final disposition, including discard. And then they basically summarize that the opposite way, which is, again, our bidirectional traceability standard. The hospital must document the dates, times, and staff involved whenever a tissue is accepted, prepared, and issued. So they're stating who and when moved this tissue throughout your process. And that's information that, again, must be documented every step of the way. The hospital documents in the recipient's medical record the tissue type and its unique identifier. So again, there's that UDI term, and this is where we're getting that data from the manufacturer barcode, and we need a way to not have your nurses keying that data into the medical record. The hospital identifies in writing the materials and related instructions used to prepare or process tissue. So whenever your tissue is reconstituted, your nurses actually have to document in writing in the health record the materials that they soaked this tissue with and reconstituted it, and document electronic copies of the instruction for use. And if you don't have electronic copies, you're expected to keep a physical paper copy of those IFU documents. Then lastly, on this slide, the hospital completes and returns tissue usage information cards requested by the tissue supplier. Again, I mentioned that all of the manufacturers for implantable devices and tissues, they are also required to track these products, so they rely on your hospital to feed them that data. And the last thing I'll say on the transplant safety chapter standards, a couple of the common things that we help our hospitals with. The hospital must confirm at all times that tissue suppliers are registered with the FDA as a tissue establishment and maintain state licensures when required. So there's actually a database where you need to go out annually and you need to be providing all of these FDA licenses, tissue bank licenses, and even state licenses, and keeping those documents on file. The hospital maintains daily records to demonstrate that tissues requiring a controlled environment and keep those records on file for at least 10 years, unless required longer by certain states. And the hospital retains all tissue records for a minimum of 10 years beyond the data distribution, transplantation, or final disposition. Now, that's really the important note here. If your hospital or your healthcare organization is doing this on paper today, which again is what we see often, you're using manual logbooks, Excel spreadsheets, or some homegrown system, what's the sustainability for the long term? Can you keep that up for 10 years as you go through the process? So that's my summary on the Joint Commission, the FDA, and the device and tissue classifications. I'm going to switch gears now, and we're going to talk a little bit about how this all applies to the UDI standard. And I'm going to start with a quote from the GS1 database, which is one of the industry leaders in this UDI space. They state that statistically, studies show that the typical typist will make one mistake in every 300 keystrokes. The chance of a misread barcode symbol is somewhere between 1 in a million and 1 in 4 trillion. So as we put that into perspective, how often are our nursing clinical end users documenting information incorrectly simply because these values are so long and so strenuous for us to pull off the package? And it's important to understand the unique device legislation that's surrounding this standard. The FDA passed what was called the UDI Final Rule all the way back in October of 2013. What they stated is that vendors are required to uniquely label Class 3 implants with one of 3 major issuing agencies by the next year. So that put us into 2014. And they allowed for 3 approved barcode styles, GS1, HIB-C, and what's known as ICC BBA. TrackCore and other systems can actually capture all UDI information from these approved vendor barcodes, and we can allow you to do things like create custom barcodes that'll properly scan into your health record. So that was part of the reason that the UDI standard was presented, was to allow systems like TrackCore to properly capture this UDI information starting at the initial point of receipt, and then transitioning it to your electronic health record. And one thing that's really important to understand as well with UDI, if you're throwing that term out, is that there is a difference between what UDI means, in that there is what's called DI and PI. DI is the device identifier. That is the part number or a unique code like a GTIN that identifies the vendor and the product itself. Then we have PI, which is the unique values. That is your serial number, lot number, expiration date, and distinct product info. And it's actually a combination of both that allow you to be UDI compliant. So for our nurses, when we look at a barcode, we need to be able to, first of all, interpret which one is which in order to get it into the health record. So here's an example of GS1. This is by far and large the industry standard. It is a concatenated, combined barcode with all of those DI and PI identifiers embedded within it. Then we have HIBIC, which is very commonly used, but it's slightly different because usually they separate the DI from the PI. We'll have one barcode with the primary info and another barcode with the secondary info. So now we've got to educate our nurses and educate our supply chain team on which one is which one's properly scannable into the EHR, which one's not, and it's starting to open that room for error. And then lastly, we have ISBT, or otherwise known as ICC-BBA. This is commonly used in the blood banking workflows. We can have multiple formats, multiple barcodes plastered all over the package, and some of them don't even have relative data to the tracking requirements. So it's near impossible for us to understand which one we need to track unless we are barcode experts. So the timeline that surrounded this UDI compliance initiative has long since passed. And what happened is when the FDA issued the compliance dates, they issued it based on medical device class. So we talked about class 1 through 3. The requirements do state that each class must bear a UDI on their labels and packages, and that the device needs to be labeled by the effective compliance date listed here. But unfortunately, extensions were permitted. And what you'll notice in my bullet list here is that class 3 was the first to go, followed by a separate category for our implantable and life-sustaining products, then class 2 and class 1, going from highest risk to lowest. But the common theme here is that each of these dates has passed. So a commonly asked question here is, have the vendors actually complied with the UDI rule? And unfortunately, the answer is no. There are still vendors who have incorrect barcodes, others who have yet to move to an approved format, and others that simply did it wrong when they attempted to be UDI compliant. Another question is, have the electronic health records accounted for UDI in their clinical documentation? And I'm sure most of you are aware of this, but the answer is yes. Nearly every one of the major EHRs out there now allows for UDI scanning in their clinical documentation sections. And you might need to reach out to whoever supports your EHR and figure out if you're on the latest and greatest version to allow that to be enabled or programmed, but it is out there and it's readily available for you to be taking advantage of today for the vendors who have complied. And the beauty of TrackCore system is that even for those vendors who have not complied, we actually have a workflow that allows you to create a UDI compliant barcode, and we've done that with all of the major EHRs. So we can actually help you with proper labeling to start being UDI compliant immediately. So I'm going to summarize the UDI aspect today with how this benefits the patient and the provider. We've talked a little bit about it, but here's a bit of a summary. First and foremost, it allows the OR staff to utilize the proper barcode scanning techniques to reduce manual data entry errors. That's obviously important to make sure we have those UDI values correct in the health record. It's more accurately capturing that implant and device data so that we can match it against things like recalls or future adverse events or reactions when we need to look these products up. It streamlines the nurse's documentation, so we're allowing them more time for patient care. The electronic capture of UDI also allows for the data transfer between providers and health systems. Since your providers are switching facilities often and health systems nowadays are being merged and acquired all over the place, UDI is a common standard tool that allows the data to consistently flow between these systems, and it can be accurate in doing that. So we can improve turnover times, we can improve charge capture accuracy by picking the right billable item when we're scanning, and we can help you to improve hospital reimbursement rates. UDI is actually now required to be included as part of the patient's summary of care documents. So in the patient's bill, you actually will be required to list the DI and PI in order to achieve full reimbursement through CMS when you bill for these implantable medical devices. And if you're not doing that today, it is upcoming. So read into it, learn kind of when that's coming to your facility and when your billing department is going to be expected to have that information included. So to summarize the presentation today, we are going to talk just quickly about how are hospitals implementing best practices. If today's presentation struck you as something that your facility could be improved upon, or that you could improve upon, I should say, and you're not doing UDI scanning today, or maybe you're still manually tracking your devices and your implants, or maybe you learned something today that shows that you're only tracking part of the puzzle and you need to bring all of your departments together and really fine-tune your process. I have recommendations here based on obviously our expertise at TrackCore, but also from what we've experienced with our customer base. One, the first thing we would want you to do is review your current tissue and implant tracking policies and make sure that they satisfy both the FDA and your accrediting organization guidelines. Don't exclude porcine valves because the FDA doesn't classify it as a tissue. That is not what the standard states. Then make sure that your policy demonstrates your process from the point of initial receipt all the way through to the final disposition. Double check that there are no gaps, even if a tissue is wasted or it's explanted, and you can find all of that information to trace it back to the vendor. And one thing that you always should do is utilize peer references. Many hospitals are actually willing to share their policies and procedures. We maintain an entire folder of them here at TrackCore from our satisfied customers who have shared them with us and are willing to share them and have them visibly available to other hospital partners of ours. So reach out to your peers, make sure that you compare notes. Then standardize your workflow for all departments. We often see that even though the operating room might own the tissue log, there is no tissue log or a totally separate process followed at the wound clinic. Maybe your warehouse or your loading dock, who plays a critical role in the receipt of the tissue, maybe they don't have a log that they're tracking that's up to the standards from the Joint Commission or FDA. So double check with those areas, wound centers, podiatry clinics, dental clinics, other ambulatory surgery centers or outpatient surgery centers, and make sure you have one standardized workflow that everybody can follow so that if somebody leaves in a critical role, the workflow and the process doesn't leave with them. And then be proactive instead of reactive. You'd be surprised how often our solution is sought out as a part of a corrective action plan. And we don't want you to be forced to implement change as a result of a corrective action plan that your accrediting organization forced upon you due to non-compliance. So even if your process is great today, there's always room for improvement. Next, we definitely want you to evaluate your health record for functionality pertaining to UDI compliance. So we just spent time talking about that. The health records do have that functionality available, so make sure that if it's available, you slowly begin to implement this for at least those high-risk products, those Class 3 and implantable life-sustaining products. And TrackCore can assist with that. I'll mention again, we do have workflows that even if you think it's impossible because vendors don't have good working barcodes, TrackCore does allow for unique workflows that can assist with that, and all you need to do is ask about how that can be implemented. So that leads me to the next point, which is evaluate TrackCore against your current process. Evaluate our software and see if there's ways that we can help you, even if you have a good process today. Our system traces all implants bidirectionally within your entire health system within one standardized solution. We automatically monitor recalls, expiration dates, replenishment levels. We manage vendor documents for all of those FDA and tissue banks, IFUs, tissue usage cards, and we integrate with the health record and the purchasing systems, so we aren't expecting you to have dual documentation in your day-to-day. So we need to store data electronically and securely and eliminate that paper logbook and those workbooks, and that's what TrackCore can allow you to do. And then lastly, we do highly recommend that you pursue RFID solutions. RFID can improve staff accountability, improve inventory visibility, reduce lost charges, reduce stock out issues, and it can automate a critical role in the storage, issuance, and temperature logging requirements for these product types. So that's the last recommendation that I'm going to provide. As I mentioned, if you're interested, please ask me for a hard copy of today's presentation. There is a slide here with a lot of helpful resources and links to go to evaluate these areas we've talked about. And with that, I'll conclude our presentation and hand it back over to Linda for questions and answers. Thank you.
Great, thank you so much, Jesse. Yes, I've got a few questions here. First one is, do any health records offer their own compliance tools for tissue tracking?
That's a good question. There are a few that probably have areas of the tissue compliance aspect, especially on the consumption side when you're actually in the health record using it, but most health records do not have the full bidirectional chain of custody. And I know specifically Epic and Cerner highly recommend evaluating a third-party vendor. So if you're interested, I have information on both Epic and Cerner that I can provide you that talks about how they recommend third-party vendors as opposed to using their own systems. I don't have that for Meditech and Pisces and McKesson's Allscripts, but it's a similar workflow, especially if you're familiar with those today.
Okay, that's great. Another question is, does TrackCore integrate with all EHRs, or is it commonly implemented as a standalone application?
Another good question. We do have a wide variety of implementations. We have facilities that choose to go live with TrackCore as a standalone simply due to resourcing availability for the integration side, or because they want to get it live immediately and then work on an integration later. But I will say that the majority of our hospital partners do end up with an integration. And we do integrate with Epic, Cerner, Meditech, Pisces, Allscripts, which has recently purchased out McKesson. So most of the major EHRs, we would have live integrations available.
Okay, the questions are coming in thick and fast here. Is it correct that if we use TrackCore, we will no longer need to mail or fax the manufacturer's usage card since TrackCore sends them out automatically?
That is absolutely correct. So we automatically create the usage card and electronically communicate it to the vendor. And not only do we do that, they actually log into a secure portal to download them, which tells you when they've actually done that. So for bidirectional traceability, we send it, your nurses don't have to do it, and you get notified in our software when the vendor has retrieved it.
Okay, that's great. Another one here is, if we have to transfer a FDA registered tissue to a network offsite facility by a certified courier, will this require us to be a licensed tissue facility?
So that is the exact question that I posed in the commonly asked questions. If you are not a tissue establishment and not licensed by the FDA as a tissue establishment, then you are only allowed to transport tissue outside of the four walls of your facility in emergent situations. If it's an emergent situation, very highly recommend that you document it as such with a lot of supporting details. But if you make it regular and routine process, then the FDA has the ability to cite you for that and force you into that tissue establishment category.
Okay, so does TrackCore allow tracking for same-day tissues received under the operating room product only?
if I understood the question correctly, you can use any of our modules independently or all together. So TrackCore can be used for just tissue tracking. It can be used for tissue and device tracking, or you could use same day only to track bill onlys and not use TrackCore at all. So I think that that's how the question was posed, and just know that every one of our solutions can work separately or together.
Okay, I've got an attendee who says they already use TrackCore for tissue tracking and experienced trouble with the barcoding process when on the fly. It's confusing for staff to know which barcode to scan. Any advice?
With that question, I would highly encourage the person who asked the question to reach out to me directly. I'm very confident we can help you troubleshoot that. I'm not quite sure I'm following what point of the process you're having issue, if it's at the receiving point or at the point of consumption. And if it's at the point of consumption, I don't know if you're using an integration with your health record. So there's variables there that I would need to dive into with you, but please reach out and I will be happy to do that.
Okay, so if TrackCore is integrated into Epic, is this a link or does information in Epic flow over to TrackCore?
Great question. So the data would be scanned into Epic, and the end user, the nurse, would document the entire implant segment, including any tissue requirements or anything like that. And then we receive a flat file extract from Epic. So it's directly sent from Epic to TrackCore, and there is no need for your nurses to document in any two systems.
Okay, that's great. A majority of the questions actually coming in now, Jesse, are for copies of your presentation. So if you would like to contact Jesse directly, his email is jessel, that's JESSEL, at trackcoreinc.com. If you email us as well, I will always forward on your request to Jesse. So we are actually come up to our hour and we have no more questions, Jesse. So thank you so much for a great and extremely informative webinar. And thank you again, once again, to our sponsor, TrackCore. Just another quick reminder that the post-webinar survey and certificate process is now automated. So the survey link will be included in the follow-up email, which you will receive in about an hour's time. Once you've completed the survey, you'll be able to download your certificate immediately, and one lucky attendee will win an Amazon gift card for completing the survey. If you have any questions, please contact us at webinar@mdpublishing.com. And for more information on our upcoming OR Today webinars, please visit our website, ortoday.com. Thank you once again, Jesse, and thank you to everybody that's attended today. Enjoy the rest of your day, and we hope to see you next time.
Thank you. Bye for now.